Okay, welcome everybody to our May Plains to Peaks Regional Network. It's good to see you all today. Today we have Sarah Davis, who's going to be presenting and facilitating from the Rocky Mountain Public Health Training Center. But before we get started with that, I thought we could do a round of introductions. So kind of a small group today so far, so maybe we'll just let people introduce as we go around. So I can start. I'm Colleen Capsmall-Stoyle at the Violence and Injury Prevention Mental Health Promotion branch in Colorado at the State Health Department. And whoever would like to go next would be great.
Oh, I'm Maggie. I didn't realize I was off mute, and here I am probably crunching and
No, you're good.
clearing my throat. I'm from Iowa Department of Public Health. I am the Brain Injury and Disability Program Manager and kind of functioning as our interim injury and violence prevention director. Yeah.
Thanks, Maggie.
Hi, I am Tracy Hardy. I am the former project officer for Colorado, and I can't seem to let you guys go. So I'm kind of stalking you. I am currently a project officer with our Drug-Free Communities program, and I have the coalitions in the states of Minnesota, Iowa, Kansas, Missouri, and Nebraska. And don't tell anyone that I'm on here, but I can't seem to let you guys go. Sorry.
Well, we have representation from some of those states too. Anyway, so
Yay!
it's fitting.
Okay.
Yeah, it's good to hear your voice, Tracy. We haven't
it's
talked in a
so
long
good
time.
to see you guys here. Okay, I'm going
Yeah.
to be quiet now. I'm getting
Oh.
emotional. I miss you. I miss
We miss you too, Tracy. I'd like to go next.
Good morning, everyone. Mandy Slag. I'm currently work for the Minnesota Poison Control System as the poison prevention educator. And I also assist with the education efforts in North Dakota and South Dakota. So that's why I'm here. I thought I would hang with this group just a little longer.
Yeah, good to see you, Mandy.
And I can go. Hi, I'm Sarah Brandspiegel. I'm at the Colorado School of Public Health with our program for injury prevention, education, and research.
Thanks, Sarah.
I'm
Jeannie.
of course. Go ahead, Peg. Of course. I'm Peg O.G. Ginsburg. I'm the Injury Prevention Program Manager in Nebraska.
Peg.
And I'm Jeannie Beets, Nebraska with the Injury Prevention Program.
Good to see you, Jeannie. You look like you're in a nice location. Sorry. Go ahead, Barbara.
It is a nice location. Hi, everyone. I'm Barbara Gabella. I'm an epidemiologist at the Colorado Department of Public Health and Environment.
And then Kate, are you still on? I think that's our last.
Yes, sorry. So I'm Kate Cohen. I work with the Colorado Department of Public Health and Environment, and I work on communications and policy work. I feel like I haven't been on one of these in a little while, so yeah. I'm glad to be here.
Yeah, I think we've kind of had some focused ones on the competitive core grants, so they've been structured a little bit differently. So hopefully everybody survived their applications if you applied. And then I just, Sarah, I don't know if you're connected to audio yet, but we're finishing up introductions, so I don't know if you want to introduce yourself as well. Sarah Barkley.
Hi, everybody. I'm Sarah. I am an injury epidemiology fellow at CDPHE, and Barbara Gabella is my mentor.
Thanks, Sarah. Okay, I think that was everybody except for Sarah Davis, who's going to talk today about the Public Health Training Center, the Rocky Mountain Public Health Training Center. So, Sarah, I'll let you do an introduction as part of that, and then do you want me to let you share your screen if you have slides?
That would be great.
Okay, let me stop my sharing, maybe.
And I'm glad that we've reached our Sarah quota for the call, 3/9 of us.
I know it's always, and we have like a lot of Sarah B's, I noticed too. So I always have to like actually say full names.
Right. All right. I think you're seeing slides and not the notes.
So.
Yes.
Well, hi, everybody. Nice to get to talk with you and appreciate hearing where everybody's from. So thanks, Colleen, for inviting me to this call. Colleen is part of our advisory committee at the Rocky Mountain Public Health Training Center. So she's heard this spiel before and felt like some of you might like to hear the spiel, which would be great. So appreciate, again, the invite. I also will mention that I'll talk about the Rocky Mountain Public Health Training Center, which is housed at the Colorado School of Public Health. We serve a 6-state region, which includes some of your states: Colorado, Montana, North and South Dakota, Utah, and Wyoming are our 6 states that we work with. And we work really closely with the other 9 regional public health training centers. So I think many of you are in the Midwest Public Health Training Centers region. And so some of you that is based at University of Iowa. So some of you in that region may already be familiar with the work that they do. So the training centers, there are 10 of us across the country. We're funded by the Health Resources and Services Administration, HRSA, to provide training, primarily virtual training and learning opportunities to professionals working on public health issues. And we've changed our terminology a little bit. We used to say that we provide learning opportunities for public health professionals. But over the years, we've realized that so many of the people who work on public health issues are across all different disciplines. So in schools and law enforcement and mental health providers and clinical settings. So really, we know that we work with a lot of folks who are addressing public health issues in one way or another. So the work that the Rocky Mountain Public Health Training Center does, we really partner with folks who have subject matter expertise in a whole variety of different public health topics to provide high quality virtual learning experiences. So even before the pandemic, we were doing most of our work online. So either via Zoom or doing self-paced trainings. And obviously that's stayed the same and increased a little bit more since we've all been doing work remotely. But in our 6 states, we're trying to serve 6 states, which is a big region in and of itself. But we also know that within most of those states, there are large geographic areas that are very rural and remote. And so it's been nice to be able to connect professionals virtually who may not have had the opportunity to attend some in-person trainings quite as much as before. So with the training center, we combine some infrastructure and technical expertise on developing and offering trainings with the subject matter expertise from the field. And we do a whole variety of different services, from needs assessments to designing virtual learning opportunities to implementing those, facilitating those, evaluating those. So our work is pretty broad, and we're really trying to think about how we can best facilitate the learning that is very practical and supports folks in being able to apply it in their right away in their jobs. So I want to highlight just a couple of the different types of learning opportunities in case any of these pique interest. Our website is up there at the top, rmphtc.org, and we do offer a variety of different trainings. So we have a whole host of self-paced learning opportunities that can be things that are short and quick, like a 5-minute overview of prevention that was actually developed for folks who are working in prevention to be able to share with some of their community partners or community coalitions to help folks not immersed in the prevention field really see the connection between upstream prevention, secondary, tertiary prevention, how all those things work together. We also have self-paced trainings around policy systems and environmental change, which is great for newer staff who are new to systems change efforts, as well as coalition or community partners. We offer live virtual workshops held via Zoom that are really interactive. We use a lot of breakout rooms, give folks an opportunity to practice and discuss with peers. And you'll see some of the topics there listed. And then we also offer longer multi-week, multi-session courses and echo learning series for folks who are ready to take a deeper dive on several different issues. So you'll see we have several around health equity, social determinants of health, leading effective coalitions. And then, as you might imagine, over the past little more than a year, we've done a lot of support for virtual conferences. So working with groups who have needed to move their conference online to help support some of the technical aspects, as well as the design of thinking about how to engage folks in the virtual space. So I also want to say I have a new puppy who's snoring really loudly. So I don't know if any of you all are hearing that, but some of us aren't working as hard as others. So what Colleen asked me to share a little bit more about with this group today, and would love to end with questions that you have and just kind of hearing different ideas that any of this sparks for you, is around a new initiative put out by the Public Health Learning Network, which includes those 10 regional public health training centers, that is the Creating a Learning Agenda for Systems Change. And we've developed a toolkit for building an adaptive public health workforce. So that's what I want to share a little bit about, this new toolkit that's available. I also want to mention and plant the seed that there is an opportunity, and we have some funding available for stipends for individuals and groups who are interested in pilot testing this toolkit over the summer. So we have kind of developing a virtual worksheet and process for groups to go through the process of pilot testing the tools in this toolkit around developing a learning agenda. So if, as you're listening to any of this, it sounds intriguing, this is the week when those applications are due. And it would be great to have folks working in violence and injury prevention help us pilot test some of this and tell us what works and tell us what's missing. So the learning agenda was created in response to the reality of the complex challenges that we're trying to address here in public health. So we know that problems like climate change and homelessness and racism are big problems with no simple single solutions. And that the challenge of change for public health is further complicated by the fact that we have ongoing inequity of resources that lead to poor health, that we have these multi-billion-dollar industries like the gun industry or food, tobacco, sodas, all of those large corporate industries that are also influencing choice. And that we have persistent underfunding with only about 2 to 3% of healthcare funding that's dedicated to that primary prevention piece. So we've got big complex challenges. We're up against big industries with limited resources to work with, which means that we're really challenged to be able to work across disciplines and across sectors to be able to address some of these complex challenges. And at the heart of who addresses the challenges are the public health workforce. So we know that the workforce is essential to being able to address these complex problems. So we want to make sure that they're well equipped to handle complex challenges. So the Public Health Learning Network is this network of the 10 regional public health training centers, and you'll see from the map what the different regions look like. So we're in pink, region 8 here in Colorado, but I know that many of you also fall into that yellowish area for region 7's Midwest Public Health Training Center as well. And a few of you, I think, with the Upper Midwest Training Center. So a work group of those of the Public Health Learning Network has gotten together and over the past 18 months has worked to develop this learning agenda toolkit. So want to go quickly over what's included in the toolkit, have a little bit of discussion. I'm curious about what this might have sparked for you. And then I'll also give you some more information if you're interested in being a pilot tester or know somebody else who might be. So we talked about, we know that the field of public health is facing complex challenges that stand at the root of many of the community health issues. And, just want to highlight a few of the foundational documents that really guided the development of the learning agenda. Public Health 3.0, which highlights how strong leadership and workforce is one of those 5 critical dimensions that's needed to carry out the work of Public Health 3.0 and to be able to address the root causes. Meanwhile, we know that the 2017 PHWINS, or the Public Health Workforce Inventory and Needs Survey, showed that among our workforce that we have some competency gaps around strategic thinking and change management and developing a vision for a healthy community. So combining those two, that we recognize that there's this need for coordinated development of the public health workforce. And so the Public Health Learning Network in 2017 embarked on a project to develop the Strategic Workforce Action Agenda, which some of you may be familiar with. Interviews were held with public health leaders across the country to think about how do we best meet the challenges, the complex public health challenges, and prepare the workforce to be able to deal with those. So interviews took place with about 47 public health leaders. And some of the highlights that they noted were that in addition to technical challenges, there are these big systems level challenges like addressing the social determinants of health. And that while traditional public health functions are still important, we need to build partnerships across different sectors in order to address these complex challenges. Meanwhile, the learning and the training opportunities that we're offering to the workforce tend to stay focused on the technical challenges and weren't sufficiently preparing our workforce to address the complex challenges. So that's really what led to the Public Health Learning Agenda being created. So when we talk about systems change, we're talking about changes to the policies and the practices or the processes that affect an entire population. And we're also talking about addressing those root causes. So not only the policies and practices, but also what's underneath that, those underlying beliefs and cultures that shape our system. So we also know that when we're talking about the public health workforce, that we need this workforce to be adaptive, meaning that they are able to respond to complex or adaptive changes, a resilient workforce that's able to work across different sectors and able to address challenges on multiple different levels. So based on the call from Public Health 3.0 and the findings from the Strategic Workforce Action Agenda, there are really three principles that are at the foundation for the Public Health Learning Agenda. One is that learning needs to be responsive to the community and systems challenges, not only individual roles and competencies. And I want to pause here for a minute because I think for those of us who have filled out lots of competency assessments or looked at the workforce and tried to see, what are the competency or the learning gaps among the workforce, that's often been our starting point for figuring out how to develop training or what kind of learning to offer is, well, where are the competency gaps with individual workers, individual professionals within the workforce? So the learning agenda kind of flips that a little bit and says, yes, individual competencies are important, but first we need to know what the community challenge is that we're trying to address. And then let's figure out what the competencies are that are needed to address that challenge. So really starting with the community or the systems challenge. The second piece is recognizing that different types of challenges require different types of learning approaches. So there's no one size fits all to learning, and that we need to start thinking longer term, interactive, iterative, if we're going to design learning that helps to impact systems change. And then the last piece is that a learning agenda allows us to build increasingly more impactful learning to address not only individual learning, but also organizational learning that's going to help get us to that systems change level. So everything that I'm talking about can be found on this website, publichealthlearningagenda.org. And you can download a copy of the Public Health Learning Agenda Toolkit there. There's also an opportunity to provide some feedback. So if you read through the toolkit and you're like, wow, this part really made sense, or I totally got lost on this, or you missed the boat on this part, we'd love to have that feedback. We really see this as version 1, and we know that we're going to be improving on it as practitioners have an opportunity to field test it. So again, another plug for being a pilot tester this summer. That'll be a nice way to really get deep into the learning agenda.
Rana?
We'll figure out what's working.
Hey, how's it going?
All right, so inside the toolkit, there are a variety of different tools. There's the conceptual framework, which serves as the foundation for the learning agenda. We have a couple self-assessment tools. There's a discussion guide that a workforce development partner could work on with you to think about where you are with your learning. And then there's the learning approach planning tool, which gets us to thinking about actual learning modalities. So to illustrate the thinking behind the learning agenda, we developed a learning framework, and this is a visual representation of the different relationships and the processes between the community and systems challenge and how an organization might articulate the need for an approach that it's going to take to learning. So you'll see that it starts with the community or systems challenge, and that's a shift from starting with what are individual competency gaps. And you'll also notice that there are several more elements before we even start talking about specific learning opportunities, which is kind of step 5 over there. So for those of you who do lots of training, that makes a lot of sense. But it's, I think, a little different than how some of us have operated in the past, where we know there's a problem and we pretty quickly jump to, okay, great, let's have a webinar, or okay, great, we need to have a 2-day Learning Institute on this particular problem. So this framework helps us break down some of those other steps in between so that we make sure that the learning that we're designing really matches the community challenge that we're trying to address. So some people love frameworks and they love all the arrows in the boxes, and some of you are crossing your eyes. So I'm not going to go through all of the steps of this, but just want to point out a few of the different relationships between these 6 components in the framework. So again, at the left-hand side, we're starting with identifying that community or systems challenge, and that's bookended on the other end, with really being clear about what does it look like if we solve this? What does success look like for our public health vision of addressing this challenge? So after we've identified the challenge, we're then starting to think about what kind of change we want to see. We want to first be able to identify define what kind of challenge it is. Is it a technical challenge where the answers are well known, where we're looking for best practices? We can call on an expert to tell us how to do something. Or is it a deeper, more complex or adaptive challenge where there's not a clear answer? It's very nuanced or situation specific. It may be part of a developing practice, an emerging practice that practitioners in the field are in the process of figuring out. So identifying what kind of challenge helps lead us to thinking about what kind of impact we're trying to have with our learning. Are we trying to change skills or knowledge? Are we trying to make policy or practices changes? Or are we trying to really make an impact on mental models and how people behave? So depending on our community challenge, we might have all 3. There might be some elements of that community challenge that are very technical issues, whereas others are more adaptive or complex issues. So after we're thinking about that, we're then thinking about, given that we know what kind of challenges we're dealing with, how do we select the best approach to learning? Is this something that individuals can learn on their own, or do we need group learning in order for it to be effective? Is this something that I can attend a 1-hour webinar and get the information I need, or is this going to be an iterative learning process that takes place over multiple months or years? So the last thing I'll mention about the framework is the gray arrow across the bottom, which really speaks to the fact that this is an iterative and ongoing process. So you might define one part of the challenge, go through the framework and figure out, here's the learning approach that we're going to take to address this part of the challenge. You're solving part of the problem, and then you're repeating the process through multiple cycles of learning so that you're in essence filling in more pieces of the puzzle of that public health vision. So here's what it looks like if you put it all together to develop a learning agenda. So you'll see that you have multiple iterations of applying that framework to think about, how do we address some of that level 1 learning or the learning of skills and knowledge? What are the technical challenges that we need to make sure people have knowledge about or have skills around? Then maybe you're able to take it more deeply in thinking about, great, now that we understand what the social determinants of health are, let's look at helping folks know how to identify what policies and practice changes need to happen and to bring those policy changes about. So moving deeper into some learning for policy and practice change. And then as you continue the process, you're able to go even deeper to really looking at culture change and addressing some of the mental models and what does learning look like in order to be able to address that really complex and adaptive level of the challenge. So if you look at this learning agenda, you'll see there's still a place for that technical learning. It doesn't go away. It's just that it doesn't stop there. And I think that's a real challenge for us in public health. And we can talk about many of the constraints that do stop us there. But the learning agenda is really pushing us as professionals and as leaders in the field to think about, in order to support the workforce in having all of the learning that they need in order to achieve systems change, we need to move beyond just the technical learning. And we need to move toward learning that helps address the adaptive challenges. So I am going to kind of fly through the next couple of slides because it just kind of dives in more deeply to the learning agenda framework, and all of which you can read about if you download the learning agenda toolkit. But really starts with, we have a lot of tools already in public health where we're assessing what the challenges are. So we're using some of those tools to get really clear about what the community or systems challenge is. And then thinking about using some of the self-assessment tools to figure out where are we in terms of what challenge are we trying to address and how are we currently addressing it. So my guess is that if a lot of us were to look across the learning that we have provided and the training that we've provided for our segments of the workforce, over the past year, that a lot of it would be at that top level of level 1 learning, where we're trying to increase people's skills or knowledge in a certain area. And we may not be getting to some of those deeper levels of learning. This is another one of the self-assessment tools that's included in the toolkit. I happen to like this one a lot because it draws the parallel to the iceberg metaphor, where we're thinking about how do we move beyond addressing the tip of the iceberg to really looking at what are the root causes, what's happening underneath, and how do we address learning for that cultural change. The third tool in the toolkit is a discussion guide, which walks you through a series of questions that kind of help you think through the different components. This is a great one to work through with partners. So whether that's a training partner or whether that's other folks in your division or program area, this is just one example of questions that help us think about how we might classify or define the challenge that we're trying to address. Is it a technical challenge? Is it an adaptive challenge? Does it fall somewhere in between? And then the third tool that is that's in the toolkit helps us put the pieces together about thinking about how we match our approach to learning, or the modalities that we choose for training, with what type of challenge we're trying to address and what level of impact we're trying to have. And so again, thinking about a webinar may be a great way to introduce someone to a new idea. It may be a great way to cover a best practice or provide information about something. If we're looking to help folks address root causes, we're going to need more than a webinar, right? So we're going to need the ability to learn together as a group. We're going to need the ability to learn together over time. So looking towards the right-hand end of that spectrum to think about some of these modalities that help us get to the deeper levels of learning. So these are the tools that are in the toolkit, and they can be used in any order or any combination. It's really about figuring out what's going to be most helpful for where you and your group is in the conversation about thinking about designing learning. The purpose of the tools is to really help us think critically about how we can approach learning differently by starting with the community, to create a learning agenda that includes multiple iterations where we deepen the level of learning in order to achieve that systems level change. So the benefit of using the learning agenda process is to be able to see the big picture. So even if we're not able to do the grand learning agenda and to do the multi-year, multi-sectoral learning opportunity yet, we're able to start to see how this particular shorter term learning opportunity that we might be offering is one part of the puzzle, and it's going to build up to this deeper level of learning. So being able to see the big picture, we know we're working in fast-paced environments, and it's so natural to be oriented to the technical challenges because they're faster and easier to address. And the learning agenda really helps us and encourages us to see the complex nature of problems, even if we're only able to address the technical challenge right now due to limited resources. At least we see how it fits into the bigger picture so that we can plan for how to address the more complex or adaptive challenges. It really encourages us to work in partnerships. So working with partners to develop the learning agenda helps us be clearer about what the community challenge is. We may approach the community challenge from our particular lens and area of focus. Working with partners from other sectors helps us see that, yes, this particular issue is a challenge, and you have to see that it's part of this bigger issue that the community is facing. So it helps us to identify what the challenge is and then to engage in collaborative learning, which we know working beyond the public health sector is going to be more likely to bring about actual systems change. And it also helps us to prioritize. We have a lot of challenges we could be addressing. So the process of developing a learning agenda can help us figure out where to start and to see the connections between some of those shared root causes or some of the shared community challenges that are impacting multiple different health outcomes. So the next steps, one is just to recognize, like, this all sounds great on paper, and we would be the first to say that public health organizations are short-staffed and under-resourced, and we have a lot of demands on our plates. So in order for us to be able to take on this more advanced level, in-depth work, we have to have support from our funding organizations that say, yes, we can fund you for multiple years. Yes, we will invest in workforce development. Having support from accreditation champions from professional organizations is going to be critical to move some of this forward. So we're talking with various different organizations now about the learning agenda and interested in getting feedback. We're also in the process of doing another literature review to tie some of the conceptual framework parts of the learning agenda, not only to public health, but also to the literature and some of the other areas beyond public health about learning approaches to solve complex problems. So I will be quiet now. I would love to hear what questions you have and to hear if there were any particular parts as we were talking that sparked any ideas for you or where you see some of this resonating with the work that you're currently doing. So I'm going to stop sharing my screen so that we can have a quick little discussion for a few minutes.
Hey, Sarah, I can kick us off with a question that I have that came to mind is beyond, sharing what the learning agenda process is do you think that there will be any opportunities that the Rocky Mountain Public Health Training Center will help practitioners in facilitating going through this process? Does that question make sense? I was just thinking, like, in my role, and I think in reflecting on that, your previous slide, the slide just before this around how we're short staffed and under resourced, that the thought of like leading these types of discussions is a little bit overwhelming right now. And so, I mean, also given that we're still in a pandemic, et cetera, but I was just curious if that's something that the training center can help support in facilitating these conversations.
Yeah, so great question. And the short answer is yes. And it's an evolving process to figure out. Again, this looks great on paper. And so trying to figure out how we help groups go through this process is part of what we're going to be learning through the next 3 months for the pilot testers. So part of what we've been developing is an online worksheet, for lack of a better name, that helps groups think through stepwise kind of how you would develop a learning framework leads to a learning agenda. And so in that process, there are some bite-sized pieces of that, Colleen, that I think that we're looking at presenting at some conferences as workshops. And so I think that'd be great to think about how regionally or as a network of partners, we could facilitate some of that. That really gets into the process of how you pull together the information you have to starting to think through developing the actual framework.
Thanks.
What other questions do folks have?
I have another one actually. So out of the different regional network coordinating organizations, the RNCOs through CDC, there is this National Peer Learning Team arm of that work. And one of the topic areas for the MPLTs was around systems change. And I think really to talk about this shift from technical problems to, I think it's conceptual problems. Is that the right? Am I using
complex?
Complex. Sorry, I was like, that doesn't seem.
Which are conceptual often.
Yeah. So I was just wondering if they're involved in these conversations. And I will admit, like in terms of the focus of CDC in this work, we haven't connected as much on the National Peer Learning Teams in our CDC meetings. So I don't know what they're doing, but I'm happy to make that connection if you haven't already.
That would be great. That's exactly the phase we're in, is figuring out who else is having these conversations. We know lots of groups are looking at how do you address the systems level change. And so getting connected. We've done we did a webinar with CDC. It was more of their learning team. And so I think it was probably different folks than who you're talking about. So it'd be great to connect.
Okay. Yeah, and this MPLT in particular was, I think, led out of the the group in North Carolina who is leading their they call it the like Southeast by Southwest regional network, and they and I can connect you with the person who's been leading that.
Okay, that'd be great.
Yeah, I'm not sure, what their plans are, knowing that CDC isn't necessarily like resourcing the MPLTs in the next round of funding. So
yeah. And we are we're leading a workshop, a learning institute, right on the day before APHA as part of APHA's Learning Institute. So that'll be another opportunity if folks want to dive into kind of working through some of these steps. That Learning Institute would be an option to do that. And then Colleen, I think we could find other opportunities to offer that to other groups. I'm curious if this sparked anything for folks as you think about the training that you offer or the needs that you all see around training or learning for the workforce.
This is Kate. I think just to be more thoughtful about, like you said, like, is the need always a webinar, or is that something more introductory? And what exactly does it look like for the given training if it's not something like, not just kind of defaulting to the standard format, and really being more thoughtful about that, and thinking about also like how we can kind of take advantage of relationships or like relationships with organizations like yours. And again, not just kind of doing whatever's easiest or most familiar.
Yeah. Thanks, Kate.
It looks like Dwayne raised his hand as well. And sorry, Dwayne, I forgot to let you introduce yourself earlier. I'm really sorry about that. I realized.
That's all right. I probably wasn't here. We're doing a vaccine clinic, so I'm running back and forth.
Okay.
So, and I apologize. I joined late, and I don't know if you had perhaps addressed this, Sarah, but thinking about the training that, so I report to a Board of Health.
Mm-hmm.
So the Board of Health has to approve everything in a very conservative community that doubts basic science. So in thinking about the need for training or at least awareness raising among Board of Health members, what consideration or attention was given to that component of the process when, for example, the self-assessment tool or other components of this toolkit were being developed?
Yeah. Yeah, that's a tough situation, and certainly one that a lot of folks are in. Of what's the political will? Where's the appetite around willing to put investment into learning? I think so. The toolkit itself does not much address the communication aspect of that piece. I think one thing that we're talking about is how to create that environment in which learning is valued. And this recognition of, if we have a workforce, we have to be able to equip them to do their jobs, and the jobs are changing. So at one point, the job was, how do you provide a vaccine? It's now evolving to not only how do you provide a vaccine, but how do you educate a community? How do you educate all aspects of the community? How do you address misinformation? How do you talk with political forces who need to allocate enough resources? So we are talking about many facets of what I think once was perceived as just a technical challenge. So there's a lot of messaging work to be done there for sure. And I certainly don't have the answer. Maybe some other smart people in the room want to talk about what you've seen to be successful in terms of making sure that there is value placed on learning.
Hi, this is Barbara. I'm sort of building on Joanne's in a way, and maybe this goes on the wish list in the future, Sarah Davis, but I'm wondering if there could be sort of a rapid version for executive directors or leaders of organizations, because if they're not in support of it or understand it, then the rest of us won't have the opportunity to fully embrace this. I know, like the Governors Association, they do rapid training with new governors, and they also have initiatives that involve all the state agencies in the governor's office. I don't know if that's a model, or whether ASTHO has something around executive leadership. And so if there could be a short version that could be included in that, I think we would gain more traction.
Excellent.
Yeah,
and maybe I'm stating the obvious, but our executive director is a political appointee, so may not have state public health experience, especially in such a political position.
Yeah, I like that idea of Barbara, of potentially partnering, with an organization like ASTHO, because I think at that leadership level, that there's with new elected officials that changes over time. So how do you continually engage them as well?
And I'll just add that this is just my opinion, but a lot of executive directors learn on the job. And because of COVID, what our new executive director has learned is how to run a pandemic, but maybe not how to deal with the challenges that you had at the intro: homelessness, wildfires, climate change, racism.
Great. I want to leave you all time to do your updates. Any other final thoughts or questions?
Well, I would just say, well, first of all, thank you, Sarah, for coming today and sharing this information. And for those of you who don't receive emails from the Rocky Mountain Public Health Training Center, they often have a variety of learning opportunities that might be useful to you in this group. So I can follow up with how to sign up for those newsletters. And then Sarah, if you want to also send out the information about the pilot testing in an email, or actually I'm sure I have it because I get other emails from you, so I can share that with this group as well. Oh, and and thanks for putting the link for to apply to be a pilot tester. So
yeah, and I'll put the link to sign up to get the training information.
Awesome, thank you.
Also in there. So,
yeah. And then yeah, thank you so much, Sarah. And I will also just say that this is, kind of part of our updates, but another reason that I had invited Sarah to the meeting today was because for those of you who aren't aware, and I know some of you are, CDC is changing how they are funding the RNCO component for the next round of core funding. So it isn't going to go to various states, but instead will be the Safe States Alliance will be responsible for facilitating all of the RNCOs. So I just thought that the Rocky Mountain Public Health Training Center and then also the other training centers that serve, the various regions in the country might be a useful tool to make sure that, there are opportunities to connect with others from your different regions. And more to come on the what the RNCO component will look like in the next round of funding. Actually, at our next learning community in July, I invited a couple of people from Safe States Alliance to talk about their plans and provide an opportunity for our group to give input to them. They have come to a couple of the RNCO leader meetings with organized by CDC, but I think it could be an opportunity to hear from specific members as well. Thank you again, Sarah.
Great.
You're welcome to hang out for a few minutes, or if you need to hop off, that's fine too. It's up to you. But if anybody has any other general updates that they'd like to share, now is the time. It looks like there might be a chat. Just one second. Oh, looks like Barbara was commenting about overlap with CSTE. So thanks, Barbara. Well, if there aren't any other updates, we can close down a few minutes early. Just as a reminder again, the next learning opportunity is on July 21st, 2021. So hopefully you are invited to that, but definitely reach out if you haven't been. Again, during that learning opportunity, Safe States Alliance will be joining us to talk about the next iteration of what the regional network coordinating organization component will look like. And it's actually the last planned learning opportunity that at least us in Colorado will be facilitating, because the core funding ends at the end of July. But I know that it seems like Safe States is hoping to have continued engagement from members, and hopefully all of you will continue to be involved in whatever our RNCO looks like going forward. So we can talk more about that in July. Other than that, I don't think that there's anything else for today. So just thank you for coming, and thank you again to Sarah for sharing more about the learning agenda process and the Rocky Mountain Public Health Training Center. And we will talk soon. Bye all.